Well, hello everyone. Welcome to another episode of On Average MD. I'm Dr. Amig, your host and your friendly rheumatologist. And today we are coming with a wonderful episode with Diva Sharma. She is the business owner and CEO of a tech company, and we're gonna hear so much about it. And you're gonna see like why is a tech company on the podcast, and you're going to see it's actually really cool. When I say that, I mean health in a new way. We are looking at all different approaches of health. So you're in for a treat. I want to apologize for my voice. I got probably an infection, probably viral, not COVID. So it's been like about 10 days. I have no voice, but it's much better than it used to be. I think I should record some blues jazz. I would probably be very successful at that right now. But thankfully, Diva is going to be the one talking, so we're good. And stay on, because we are really going to share why Diva is sharing her tech company and what she's doing, and it's related to nutrition and health. You're going to see it's wonderful what Diva and her partner have created, and also because we are going to launch with On Average MD, and I'm going to use. We at On Average MD are going to use this health tech company. So there are a lot of things that are exciting. So without further ado, Diva, thank you so much for being on the show. I apologize for my voice.
Thank you so much for having me, Dr. Meek. This is so exciting. We are very excited to partner with you, and you do sound great. So don't worry about that at all.
Wonderful, thank you. I'm going to make you talk so I don't talk. So,
absolutely. I'm totally down to share everything I know today. So
wonderful. Well, so I've had a lot of physicians, I've had health coaches, have had patients on the show. The truth is that I've never had a health tech company. And so before we go into what Flair Health is and what you're creating, which is, I think, going to disrupt the market, can you please tell us about you and where are you coming from? What have you done, and how do you end up in the healthcare space?
absolutely. Specifically for me, I started my journey in digital health and healthcare at the age of 15. I grew up with a grandfather who had immense chronic disease. He had heart disease and he had diabetes, and would go to overcrowded hospitals to get his vitals checked back in India. And that sparked my interest in wanting to create a platform that would enable doctors to remotely track their patients, their health metrics, their parameters, glucose readings, etc., remotely, and then deliver remote care models. So I embarked on a journey to build a digital health solution that was patented and then internationally recognized by the European Union government and several other governments. So that's where I started off with my journey in healthcare.
You were 15. You were 15 years old.
Yes, it
Wow,
was
that's
it was
incredible.
very early in my journey, and it led to a lot of other amazing opportunities down the line. So I'm grateful that I was able to work with so many amazing mentors and health tech leaders to drive that solution forward.
That's so cool. And so then how did you end up in the US, and how did you end up doing, like, tell us more. Like, there's, I know so many physicians. I don't know a lot of tech persons. I'm excited now.
Absolutely. So I was accepted to Stanford University for my undergrad, in undergraduate studies in computer science. And then I focused on health tech there, actually. So a lot of digital health classes, collaborating with doctors, working with Stanford Medical School, and worked at several digital health companies during my time, including at Ancestry and several other companies. And ironically, also met my co-founder, Shobha Dasari, at Stanford through one of the health tech organizations, where we immediately connected because of our passion for healthcare and digital health.
Okay, that's excellent. I love it. You're like the typical American dream when we're thinking of it. I love it. Not typical, because none of them are typical. But when I was in France and I was imagining like America and all of those opportunity, the land of opportunity, this is exactly what kind of like what comes to mind. So it's really cool to see it happen. And well, actually, I would love for you to tell us a little bit about Flair Health. Like, so how did it come? Like, how did you guys decide? Like, okay, we need to do this. Like, tell us about
Mhm.
it because it's so exciting, and I
Absolutely.
think everyone. And I can share what I see also in what you're creating. But yeah, I'm so excited to hear from you.
Absolutely. So essentially, Shobha and I both have had experiences, separate experiences touching the need for clinical nutrition. And I'll dive specifically into that and then share what Flair Health is. But what Flair Health does is basically we partner with medical practices like Unabridged MD, and we enable their patients to pair through our technology platform with clinical nutrition services, um, which involve a dietitian and a health coach on our team. And our technology platform powers the interaction so that a patient can see a dietitian and health coach at any point in time, from the care of their home or from their car, wherever they are, and really be able to get specific advice on how to personalize their nutrition based on their medications, their meal plans. And the best thing is, this is done in partnership with the clinic, and the clinic office and the doctor. So that's something that we realized that was a huge gap, and I can dive deeper into how we came across that gap. But that's a little bit about us.
Yeah, I love it. So I want to say, like, from my standpoint as a rheumatologist, I think what really excites me about what you're doing, and I have told you and Shiva this, that what I love about it is how you're seeing this gap and you're like, okay, well, there is a gap, and how are we going to fill it? And I agree with you. I think that the nutritionists are wonderful, but sometimes they are working on their own. And so we have the patient that's here, and like he's trying to understand, like, okay, what is the diet that's right for my condition? But then the nutritionist may also have like some other ideas, and maybe they are specialized in their condition, but more often than not, they are not necessarily specialized, or maybe they are focusing on something that's not necessarily what the rheumatologist I'm thinking of would focus on. And so
Mhm.
I like, there's like a couple of things that I love about what you're offering. Number one is the partnership with the physician. I think that that's so incredibly valuable because you become this extension of the physician office, which I think is remarkable. And it's not anymore just like one other person to see for the patient, but rather a continuation of the practice that they're already seeing. So I think that that's super valuable. The second is that I do love technology, but I think technology sometimes can be painful and like can kind of overtake us. And in this case, what you're doing is that you're helping people track what they're doing. So you have this tracker on this health app, and at the same time making sure that there is someone that's a person, and that's so needed right now. That is a person in real life, right? That's touching base with the patient. And to me, like, I've been had to deal with, needing to stop gaining weight and eating healthier for my own health condition. I know that the accountability is so important. And so creating that, offering that to the patient is huge for me. So that's why I'm so excited to partner with you. So tell us a little bit, like how does it work from a tech company? Like when you created that, like what has been the things that have worked really well for you, the things that are a little harder and like our challenges?
Absolutely. Yes. So for us, our top priority is the patient experience and making sure the patient is matched with the right dietitian, the right food protocols in collaboration with the physician, and then also, of course, has regular check-ins with health coaches. So that's what our clinical model is. And what's worked really well, of course, you mentioned the human touch. So of course, combining human touch with technology is paramount. And we know that doctors in this country, specifically rheumatologists, there's a huge shortage of them. And there's not enough time to go deeper into what's triggering a patient's condition, what's causing inflammation, really addressing the core drivers of that chronic disease. And food, in response to medication and a patient's lifestyle, can really ameliorate their condition. And essentially, our tech platforms, interactions, and the way we involve a health coach, a dietitian into the care model, all virtually from the care of a patient's home, is something that we think is of immense value. And we're hearing from patients across the country that that is something they are really interested in. They care a lot about it. And of course, as you think about challenges, there are obviously always challenges as you do start working with patients on really getting specific on the specific chronic disease, and that's really where we think technology is the core supporter here. In that, there's a lot of data in a patient's life, whether it's the foods they're eating, the medications they're on, their clinician's advice, and really compiling all of that into an integrated way so that we can design that care model for the patient is something that has traditionally been a challenge, but we're doing that through a lot of extensive data through our tech platform. So that's a little bit about what's great and what we're working on and what's exciting.
Mm-hmm. That's really exciting. So tell us, like, so when it comes to the patient, so there's two players here. There's the physician whom you work with, and then there's the patients whom the app work for. And so can you tell us, like, how do you partner? I guess, how do you partner? Like, you want to tell maybe how you got to partner with me and how we're going to partner in the future more. And maybe then we'll talk about like how it looks for the patients as well. But I think it's kind of cool to show like the behind the scene when it comes to the relationship with the physician.
Absolutely. And, it was so great to meet you in person and realize that we had so much in common in terms of our goals for patients and patient care. So we really think that partnering directly with the physician is really the best approach to make clinical nutrition accessible to patients everywhere. So the way Flair works is we partner with a medical practice by becoming an extension to their practice. That is, we operate out of the practice as an external partner, of course, through HIPAA compliance and all of the privacy measures in place. And then we work with the clinician and the clinician care notes to understand more about the patient's specific condition. And with that being said, we then have our tech platform match a patient that's that a doctor or their patient liaison believes could benefit from Flair services onto our platform. We onboard them. We conduct a quiz with them to understand more about their food intake, their health condition, also about their specific restrictions on food and diet, and then match them to health coaches and dietitians who do more weekly care. So we're operating out of the practice, and that's how we work with clinics.
Yeah, that's really cool. So from my perspective, I would say that what I love about what you're doing is that you're really trying to, I mean, it sounds to me, and that's what I'm loving about Flair Health, is the fact that it's really adapted to my needs as a physician. And so, like, I'm a whole food plant-based, but only 80%, meaning that, like, to me, food is a religion almost. I'm a snob. I'm a food snob. And so I could not ask my patients to not enjoy what they're eating, and I could not ask them to restrict themselves only, right? And I know that you're helping to do this in this sort of this view of what nutrition is. It's not just diet, it's like a nutrition, like choosing what we're eating. But I think also what's really cool about Flair Health is that it's not just about nutrition. I think it's also health coaching, and you're starting here, but clearly we're talking about broadening the offering, and with the health coaches that are going to make sure that our patients are doing the movements that they need to do. Personally, I'm all about meditation and visualization, and I can see this really happen thanks to your app. And it's really funny. Again, I like apps. I think they are good, but I also know that an app is not as good as a person. And so I really, really love the fact that there is a touching base with a real person on a weekly basis. And I think you've really thought of this very well. Now, well, I'm kind of almost talking about how it looks from the patient's perspective. What I wonder is because you have created an app, right? And you're very well researched and very successful and very smart. And so I'm pretty sure that you've done the research when it came to why is it so important for people to look at their data? Can you tell us about it? Like, because I think that's important. Like, why would someone want to pull make sure that they have their data into this app. And again, it's all HIPAA compliant, no problem. I mean, personally, if people want to look at my weight, it doesn't matter to me, but, I could see how that it could be like, okay, I don't want to share this with the world, but, why, like, and I know that there's some research, like, tell us a little bit more about this, like
Absolutely.
following the data.
Absolutely. So data is very important, and we've based our platform off the principles of what we call lifestyle medicine. Of course, recognizing that there are many different pillars: nutrition, movement. So essentially, based our platform on the principles of lifestyle medicine, which covers many different pillars, specifically six pillars of a patient's life, including nutrition, movement, stress, sleep, social connection, and avoiding risky substances. And there are studies that indicate that lifestyle medicine protocols can actually reverse chronic disease, even reduce 60% of patients based on the amount of medication they're already taking. So with that being said, data is really important in that there's so much data out there in a patient's life, whether it's to the foods they're eating and tracking, potentially to their Apple Watches and fitness devices, their own feedback on their sleep, the way their stress is going, and having professionals analyze that. And right now we're starting with diet and with dietitians in response to clinical nutrition. But you mentioned data, really ameliorating those conditions. And with that being said, we really believe that patients themselves are incentivized to want to feel better. There's evidence that improving your lifestyle, including adopting plant-based diets, as you mentioned, can reduce autoimmune symptoms, specifically with RA and markers of inflammation. For example, there are so many other studies that prove like plants for joints, for example, could improve symptoms of RA, improve weight loss, improvements in cholesterol. So there's a lot of data out there, and there's proof that this data can really tangibly improve a patient's lifestyle by pairing each patient with a dietitian and health coach. This is the first step towards analyzing that data and really making a patient aware of how their food's impacting their condition. But of course, we see that there's data across several different pillars, and that's how we structured our platform from the ground up to ingest that data and then have professionals analyze it.
All right. Well, that's excellent. I really love all of this. We're coming toward the end of our show, and I wonder if you could tell us, so it's hope driven by science. Do you have any story that can provide hope to our people that are listening right now?
Absolutely. I'd actually love to share Shobha, my co-founder's story. Shobha was diagnosed with Crohn's disease at the age of 13. And she went to several doctors and, of course, had various instances of inflammation, wasn't able to figure out what was going wrong in the way she was taking care of herself, and turned to her family as she was very young to start, making these changes in her life, trying to find what could really help her improve her condition. And specifically with autoimmune conditions, it's really hard to know what exactly is triggering your condition. So Shobha scrappily spun up meeting dietitians, finding a health coach, and working with her parents to stitch together these different elements of what could improve her condition. And really improving her stress levels and her nutrition worked out very well for her, specifically getting granular on what foods to cut out. And the dietitian and health coach really helped her overcome this. She wishes that more clinics could offer something like this to patients. And Shobha's a living example of how now that she is in remission from her condition, that there is hope for patients out there that are struggling, that don't have the answers, that by actually availing services offered to the doctor's office that let them get access to clinical nutrition and other lifestyle changes, they can really do much, much better. So really, Shobha's a living example, and that's really also where the idea for Flair was born. So.
Yeah, no, that's such a beautiful story indeed, and that's the one she had shared with me. And I really believe in that. I think for me as a Western medicine doc, I would say that I think that at the beginning, when you have an inflammatory condition, you really want to be as fast as possible to put the person in remission. And I don't use cure as a word, like, because you don't know that you're going to cure unless, after 5 years without treatment and provide anything. And it sounds like Shobha might be, more like closer to cured. But when it comes to remission, we really can attain that. And sometimes what I've seen is some patients, they just change their diet. Like, for example, you take gout. Gout, it's so obvious that if you change your diet, you can actually go into remission. And you can actually cure it in this case because you don't need medication forever. And I think that that's really, really, really good. And very, very exciting for patients to know that they are going to have a diet that's going to really just be targeted to them. The other thing that when you said that I really appreciated listening to is the fact that not one diet is going to be perfect for everyone. And thanks to what like Hair and Flair is that what you're offering is really something that's targeted and that's individualized for each patient. So, right, someone may have gout plus ankylosing spondylitis. I definitely have one patient. It's very rare, but it does happen. And so then we can really just target for both of those conditions. And someone else may have, more of an issue with gluten, maybe some issue with dairy and so on. And I think that, there's not just one size fit all, and that's the job of the nutritionist. Okay, so Diva, how can we find you? How can patients find you? How can physician and medical office find you?
Absolutely. Yes. So for physicians, we're definitely very excited to share more about our platform. So we have a website. You can reach us at flairhealth.com. So that's FLAIR health.com. And also could send us an email at hello@flairhealth.com. And we are partnering with practices across the country. We are actually, so we have two models. We work with practices that want to offer, be able to accept insurance directly from for their patients. And so what we do is we work as a chronic care management service that is clinical nutrition focused right now with some of those clinics. And actually, most insurance companies do reimburse for those sort of care models. So that's one way. And then the second is, of course, is working directly with concierge practices as well. And then patients can find us right now through their physician practices. But with and so that's definitely something that should be on the lookout for in the next year or so.
Yeah, wonderful. Well, Diva, thank you so much for coming on the show. It's been such a wonderful conversation, and I'm very excited to work with you guys. I think that our patients at OnAverage MD can already be on the lookout for an email and some social media post starting in January because we're starting the year well, and I'm very, very excited about what you guys are doing. I think you're really onto something, and I cannot wait to see more physicians, more practices, as well as more patients enjoy your app. So thank you, and the people that are on the app. So thank you so much.
Thank you so much for having me, Dr. Meek. This is incredible, and we're excited to partner with you and support your patients. So yes, thank you.
Thank you.